Hello, it's Weekend File on the NTA and we are live in Abuja. The best defense against any outbreak is a strong health system. So says the World Health Organization, WHO, and the COVID-19 pandemic is revealing how fragile many of the world health systems and services are, forcing countries to make difficult choices on how to best meet the needs of their people. The COVID-19 pandemic is straining health systems worldwide with the rapidly increasing demands on health facilities and healthcare workers, threatening to leave some health systems overstretched and unable to operate effectively. Previous outbreaks have demonstrated that when health systems are overwhelmed, mortality from vaccine-preventable and other treatable conditions can also increase dramatically. Bearing that in mind, the federal government and other stakeholders have remained alive to the challenges of the novel COVID-19 pandemic, right from its outbreak to its management and containment at various stages, leading to the new normal where certain choices and decisions have to be made to suit the realities of the time. These efforts are so far balancing the demands of responding directly to COVID-19 while maintaining health services or health service delivery and mitigating the risk of system collapse. Robust planning and coordinated actions between government and health facilities and their managers have equally led to complicity with the highest standard in precautions, especially in hygiene practices and the provision of adequate supplies, including personal protective equipment, as well as effective management of patients with other health conditions. Little wonder then that Nigeria is gradually but steadily returning to normal life amidst COVID-19 pandemic. Schools are reopening and airports are alive once again. So tonight we will pay attention to COVID-19 and increasing routine health services on Weekend File. And our guest is Dr. Osagie Ehanire, Minister of Health. We shall also feature detailed reports from across the zones. I am Kenen Ima Abodike. The news now. Let's start by joining Ogochukwuka live in Benin for update on the Edo election. Ogochukwuka, what is the mood and situation in Edo right now? Gachukuka is not really hearing me at the moment, so while we wait for her to get ready, let's quickly tell you that Vice President Yemi Osinbajo and Lagos State Governor Babajide Sanwo-Olu have inaugurated the Eco MSME Fashion Hub 1 in Lagos. The MSME Fashion Hub 1, which is a shared facility under the National MSME Clinic scheme, is expected to serve 380 small and medium enterprises daily. Nosa Usula reports.
MSME Fashion Hub 1, which is a shared facility in Lagos State under the National MSME Clinic scheme, is expected to serve 380 small and medium enterprises daily. The Vice President, who gave his message virtually, assured Nigerians that the federal government remains committed to promoting and developing small businesses, especially in the areas of skill acquisition.
With the launch of the Eco MSME Fashion Hub 1, MSMEs in and around Ikeja will no longer have to travel far to use equipment that is expensive for individual businesses to procure by themselves, such as those for making buttonholes, monogramming, and other such specialized tailoring activities. With its full-scale production line, this hub will enable production of a diverse range of clothing and garments, wedding dresses, military uniforms, office wear, and similar products.
Given you commitment that will make sure that this facility does not fall below its expected standard from today onward. We will continue to monitor it and will ensure that nothing falls below the standard that we're passing on to the beneficiaries.
The Commissioner for Commerce, Industry and Cooperatives, Dr. Lola Akonde, said the Eco MSME Fashion Hub 1, which was the first phase of the shared MSME fashion facility, is equipped with state-of-the-art machinery such as industrial button hole machines. In Lagos, Nusa Osula, NTA News.
All right, let's try and rejoin Ogachukwuka live in Benin for an update on the Edo election. Ogachukwuka, if you can hear me, tell us the mood and situation in Edo right now.
Thank you very much, Kene. The mood is very calm. It actually rained this evening. As expected, people finished their voting before the rains began. And right now, at the INEC headquarters, nothing seems to be going on at the moment anyway, but party officials are already here, pressmen are already here, waiting for the collation officers from the local government areas to arrive. I actually got an information from an INEC official that at 10 o'clock they will reconvene. They will reconvene for collation of results, if any arrives.
But so far, we want to believe that everything is going normally, no problems at all.
For now, everything is going on smoothly. The INEC headquarters here is very calm. Security personnel are all over the place. But there were pockets of violence in parts of the state, like Igbobauka and Igo. But the security operatives were up to the task. The DIG was on ground with his men going around to see what was amiss. And of course, they were taken care of.
Let's leave you for now. Thanks for the update from Edo. Of course, you are in the capital city, Benin. We hope things will turn out very well at the end of the day. Thanks indeed, Ogachukwuka.
Thank you very much.
The unemployment gap in the country through its various empowerment programs for the citizenry. The Minister of State for Labor, Festus Keyamo, stated these are the disbursement of microloans under the NTA Micro Enterprise Enhancement Scheme in Sokoto. Shehu Mohammed Dati has the report.
Youths and women have gathered here for another federal government empowerment scheme. This time around, it is the National Director of Employment Micro Enterprise Enhancement Scheme targeting 2,400 women and youths in Sokoto. It is a music to Mustafa Bello's heir, who is a beneficiary and had learned carpentry. He said the loan will enable him start a business. The Minister of State, Labor and Employment, Festus Keyamo, said the move is part of the federal government's drive to lift as many people as possible out of poverty.
The major tool we have decided to use to lift people out of poverty is to empower them, either by skill acquisition, either by support of macro, small and medium-scale industries so that they can be self-employed.
And they have a moratorium of about 3 months before they start paying, and the payment rate is just about 833 naira per month. This is in form of revolving fund.
Ready to partner with anybody, how much more of our own federal government under the able leadership of President Muhammadu Buhari on any program that will bring succor, relief and development.
Meanwhile, the minister has pledged to support these students of UK German Academy in Sokoto through skills acquisition, and the federal government plans to catch them young. The Minister of State was also at the Sultan's Palace, where he briefed the Sultan of federal government's empowerment and poverty alleviation programs. In Sokoto, Shehu Mohammed Dati, NTA News.
But on the state government has called on the Federal House of Representatives to support its reconstruction, rehabilitation and resettlement drive as a durable solution to the insurgency. The state governor, Professor Babagana Umar Zulum, made the call when the House Committee on North-East Development Commission, led by the chairperson Khadija Bukar Abba Ibrahim, paid him a courtesy call at the Government House, Maiduguri. Mohammed Goni was also there.
On the Northeast Development Commission was in the state for oversight function on activities of NEDC, which Governor Babagana Umar said has impacted positively on the lives of the IDPs in the Northeast. Professor Babagana Umar expressed concern over the growing number of IDPs with no access to farmlands, and further noted the growing agitation to return home amongst the IDPs.
That the need for this very important committee to interface with the larger House Committee to look into the possibility of empowering the teeming youth growth in the state.
Professor Babagana Umar then called on the House of Representatives to support the NEDC and the security apparatus in the Northeast, including the civilian JTF and hunters. He appreciated the Northeast Development Commission for doing a good job and further urged the Commission to work with the state governments of the Northeast. Chairperson of the House Committee on NEDC, Khadija Abba Ibrahim, noted the prostration in an environment with constant threat, which resulted in huge loss of lives and infrastructure, hence the approval of enough funds for NEDC to execute its mandate.
Your Excellency, I do not believe in sitting down in Abuja to receive papers showing work done. We want to see work on ground.
The chairperson clamored for continued partnership between the Commission and Borno State Government to move positively towards actualizing the Commission's goal. In Maiduguri, Mohammed Goni, NTA News.
Stakeholders in security in Niger State have advocated the need for the private sector and individuals to collaborate for adequate funding of security. This came to fore as they brainstormed over the state government's proposed Security Trust Fund bill forwarded to the legislature. Rothkang Dimka reports.
By the increased cases of violence and insecurity across the country, several state governments have come up with measures aimed at tackling the menace. One of such instruments is the Security Trust Fund, on which state governments have forwarded bills to their respective houses of assembly for passage into law. Niger State government is keen into this initiative, as it had also forwarded the Niger State Security Trust Fund bill to the state legislature for passage into law. Preparatory to this, the state government, through its Law Reform Commission, put together a workshop where stakeholders from different security formations and paramilitary outfits rubbed minds on how best to achieve desired goals upon the passage of the bill.
Indeed, we have to sustain peace and security in the region because we cannot afford to go back to the dark days of terrible experiences.
On the part of Niger State, we have had a great share of this national security challenge. But as a government under the leadership of His Excellency, we are not complacent.
Stakeholders at the event agreed that since government alone cannot live up to the task in security, it should be prioritized. Hence the need to have a bill where the private sector and individuals will contribute through adequate funding. Rotkan Dimka, NTA News.
Emergency responders have recovered a dead body from the multiple road accidents which occurred at Anthony in Ward Bagada in Lagos. Michael Olaleye reports that there is a sense of worry among residents who lamented that accident is now becoming a weekly affair in the area.
It all started when a tanker loaded with petrol lost control and fell beside a containerized truck with power generating sets. The effect is devastating as a tow truck and an excavator all got burnt beyond recognition. Emmanuel Unwanga is a security officer attached to one of the buildings close by. He cheated death by a whisker but sustained injury on his right leg.
At times we hear when we sight, see the situation can run go inside. But yesterday on was too much.
While Emmanuel was lucky, the whereabouts of the driver of this truck still remain a mystery, but a dead body was recovered from the scene.
I walked here, but there is no way a vehicle can enter here for over a week now because of this tanker. The man that brought this tanker, he was the one that rose down here yesterday because he couldn't go home. He was here to secure because of the area boy.
In the process of salvaging the damage left by the accident, Another tanker loaded with petrol fell off its trail, but quickly contained by emergency responders.
If not because of our combined and aggressive operation, we could have experienced another fire in here. But thank God, we are able to control that, and we've commenced transloading of the fuel now.
In a related development, a 3-story building located at number 15 Asarudin Road, Ilepo bus stop at Iyano Ejigbo, has caved in, although nobody was trapped in the rubble due to the closure of schools. But information gathered revealed that the building had previously showed signs of distress. In Lagos, Michael Olale, NTA News.
President Muhammadu Buhari has expressed his condolences to the government and people of Ebonyi State over the motor accident on Akezopu River Friday night, in which several passengers were feared dead. The president said he is saddened by the colossal loss of human lives, adding that the thoughts and prayers of the government and people of Nigeria are with the families of the victims of this accident. He commended the Ebonyi State government in spearheading the rescue and recovery efforts, as well as the support it has received from the neighboring state governments in that regard. You're on to Weekend File, and our focus is on increasing routine health services amidst COVID-19. And our guest is Dr. Osagie Ehanire, Minister of Health, and he is already waiting for our conversation. Time to go on a break. We will be back after some reports. Don't go away.
At Elizade Autoland, we don't just sell quality, we build quality. JAC Motors, assembled in Nigeria by Elizade Autoland. High demand for fleets of JAC Motor brands by members of the public and private sectors. JAC Motors are clearly built with one purpose in mind. They are built to serve. Elizade Autoland, sole distributor of JAC Motors in Nigeria.
My tailor no be your mate. He no dey for your grade. If he knock you agbada, your tailor go dey hail am. Anytime I want to celebrate, he go show the cloth, he no dey late. He dey sweet me like a chocolate. My tailor no dey disappoint. Tailor we go Harvard University. If they knock me, baka. You no go the job like a baka. If you see my tailor, tell her say I dey hello. Tailor, oh that don't me. Tailor, oh that don't. See you get it from fashion knowledge. Okay, my tailor is a big passion. Tailor, oh that don't. Yeah. My tailor no be your mate. Tailor, oh that don't. Tailor, oh that don't. My tailor no dey your lane, he no dey delay. If he knock your shokoto, your tailor go dey lambo. He no dey forget your trouser, he no dey waste time. He dey finish working for state, if all no dey sago. My tailor no dey disappoint. Tailor we go Harvard University.
Make that switch today and enjoy all calls at 11 kobo per second. Free data on every recharge and double data for 3 months on the network with the widest 4G coverage. Airtel, the smartphone network.
Introducing the new and tasty Peak Yogurt, the nourishment to be you, do you, and go for you. Peak Yogurt comes in orange, strawberry, and plain sweetened flavour. All available in nearby stores.
Go for you, must go reach my peak.
Issa too like football on Top Go TV. Sote him forget say him be best man for him party wedding. Amaka disappoint her bobo all because of football. Kola and him family supposed come out, but then gas change plans because for this new football season, Go TV get correct football action will make sense. Get Go TV decoder wey come with 1 month Go TV Max subscription for only 9,500 naira. Go TV, live it.
NTA News 24. A 24-hour news station brings to you news and happenings 7 days a week.
News at 10 a.m., news update at 11 and 1 p.m.
News desk at 3 p.m. and 6 p.m. and late evening news at 11 p.m.
Follow us on any of our platforms and keep abreast of events and current affairs within and outside our shores.
We are on DSTV channel 419, GoTV channel 46,
StarTimes channel 101 and Free TV channel 703. Join us.
Welcome back to Weekend File. The coronavirus pandemic, or going by recent figures released by the Nigerian Center for Disease Control and CDC, the flattening of COVID-19 curve is generally becoming a reality in Lagos State. Health experts, however, warn that this achievement, which is being applauded, calls for more determination towards prevention in order to avert a spike. Hingino John Adams reports on plans to checkmate a second wave.
Coronavirus pandemic almost brought the world to its knees. People are now learning to live with the virus by making lifestyle adjustments like regular hand washing, use of face masks in public places, physical and social distancing. Lagos, the epicenter of the pandemic in Nigeria, has had numerous socio-economic challenges. After several months of tackling the COVID-19 scourge, a decline in the number of daily new cases is being recorded in the state. This is good news in addition to Lagos having the highest recovery rate in Nigeria. This does not mean that coronavirus has lost its grip on the state. The Lagos state government and other key players in the health sector are bracing up to this fact by effecting strategies to stop further spread.
In line with the Presidential Task Force directive on no mask, no entry, no mask, no service, enforcement agencies will from the coming days and week charge defaulters to court as the period of grace is over.
Many laboratories are coming up, so I imagine more tests are being done, and yet the cases that we are recording is low.
Although the partial lockdown is still in force, life is returning to normal. Schools are gearing up to reopen, with emphasis on the safety of students and personnel.
What we have put in place, the use of face masks, other running water, internet facilities, the social distancing among the students, at least maximum of 20-25 in a class.
The teacher has a lot to do by making sure that the students obey all the protocols.
As the war to thwart the pandemic remains fierce, Lagosians are optimistic that the state and the rest of the country will emerge stronger, even if humanity as we know it may not remain the same. In Lagos, Hingino John Adams, NTA News.
The coronavirus pandemic has undoubtedly brought about a tremendous change in how people around the world carry out daily activities. Fatima Sanusi Karaye in this report tells us how people in Kano State are coping with the new normal after the wave of COVID-19.
Novel coronavirus has delivered a negative effect on the world, which experts say will continue to have a lasting effect. Kano is no different, as the economic powerhouse of northern Nigeria is also hit by the virus and still struggling to rise. While normalcy is beginning to return, people in the state are adapting to the new normal with grace after the devastation. Hawa Abdullahi, a frontline worker, like her colleagues said, they are adapting to their new normal after the wave of COVID-19 and are confident will keep the virus at bay.
As you can see, look at our water dispenser there where you wash your hands. If you are coming to the hospital as a staff, you have your masks.
We are trying to establish social distancing. The only challenge we have is the patient turnover.
In public places, people are struggling to adjust to COVID-19 protocols. With pervasive informal sector, which makes up 60 to 70% of employment, providing livelihoods to the most vulnerable in the state, adjusting may be difficult.
I'm not afraid of what I don't know. I want to say it out there that when Ebola came, we were able to see patients that were affected with Ebola. Please, if coronavirus is real, let's have evidence.
Unfortunately, that is his belief. People like Kevin needs more sensitization and education as he struggles to come to terms with reality on ground. Others, however, are taking precautionary measures to protect themselves.
Wearing of masks is very, very important because this COVID is not written on the forehead. You don't know who has it, you don't know who is free from it.
But this pandemic is roaming about. People are taking it slightly, but it's not like it's real.
For Hawa Abdullahi, going back to business as usual may not be in the near future. Therefore, we'll continue to do the right thing until COVID-19 situation changes.
People are now gradually returning to new normal after the storm of COVID-19, which has brought along new habits to curtail the transmission of this deadly virus. Stay safe, continue to follow COVID-19 protocols. In Kano, Fatima Sanusi, RIA.
Time to engage our guest tonight, a man who has been at the forefront of the fight against COVID-19 and also at the helm of affairs in Nigeria's health sector. Join me as I welcome the Minister of Health, Dr. Osage Henry. Thank you for joining us once more on Weekend File.
And thank you and good evening.
There is no doubt COVID-19 has disrupted routine health checks and services globally. Now, do you see that as a threat to the health sector?
It is a threat to healthcare delivery in many countries because the fear of COVID-19 and also the very strong focus on COVID-19 has impacted routine and essential health services, which in some countries, particularly in poor, lower income countries and lower and medium income countries, suffer consequences, which can mean that the fatalities from other diseases that are non-COVID can begin to overtake the fatalities from COVID-19 itself. So we are putting great emphasis on ensuring that routine and essential services are not impacted, that all our health workers are protected, that they are safe, that they are well trained in infection prevention and control, and that they are given the confidence to return to duty and render service, and also that the public is given the assurance that they will receive service and that they are safe also.
So, in other words, we do know what it means, when we neglect the other conditions in patients and then focus all our energies on COVID-19, which is indeed a global issue now. A lot of people say women and children are most vulnerable at this time. What plans do we have on ground to, take care of them?
With regard to neglect of routine services, yes, women and children are more vulnerable, although men are generally more vulnerable with COVID-19 itself. But because women are no longer able to get the routine maternity service, routine reproductive and neonatal services, there is an increase in fatalities from childbirth and also from normal usual diseases that affect women. And there's also a reduction in routine immunization. So you have a slight increase in vaccine preventable diseases, which we are struggling very hard to make sure is checkmated and that normal services are reintroduced and in fact improved.
So how does this affect some major laboratories that were designated solely for COVID-19 testing, to the fact that they have also neglected the other areas of health conditions?
Well, there are special laboratories for COVID-19 testing. Those are the PCR laboratories, molecular diagnostics, and they do not normally affect the other laboratories. So those medical laboratories are functioning as usual. What has happened is that in some places, some laboratory technicians have become infected and have not reported for work because they're under treatment or observation. And also that patients who are afraid of contracting COVID-19 do not think that they are safe when they go to the hospital. So we are trying to reassure them that all the conditions are there for their safety and that they should return to work. There's been a lot of training that has been done for healthcare workers, and they have been given the encouragement and confidence to return to their normal duties.
We ask that particular question because we know that one of such facilities in Asokoro has actually been returned for routine health services. Now that you've mentioned that efforts have been made to let people lose their fear and return to some of these facilities when the time arises, apart from the training and other things you've mentioned, what practical things do we do? Because the mindset of people, because it comes with stigmatization sometimes, when they say that facility, don't go there because something like that happened, in the recent past. Bringing people back to normal life is not very easy. Now, in this particular context, Honorable Minister, what do we do further to ensure that we don't lose some of the facilities even when they have been returned to normal work?
Well, there is a lot of community engagement going on, risk communication and the community mobilization to explain to them the precautions that you need to take in order to protect yourself from COVID-19 infection. Those are wearing of a mask, as I'm wearing now, washing your hands regularly, and avoiding crowds and avoiding gatherings of too many people. That's for the general public. For the workers themselves, they are provided with PPE, personal protective equipment, and we are also talking to community leaders. We have engaged traditional rulers many times, and the National Primary Healthcare Development Agency and the Department of Family Health at the Ministry of Health have been very active in trying to pass the information around and contact all the state governments. I have also addressed the commissioners of health of all the states. We have had also a National Council of Health meeting in which these topics have been amplified and made very clear to people. So we are doing everything we can both at the grassroots and the level of leadership to ensure that people regain confidence in the health system and know the difference between protecting themselves from COVID-19 and accessing routine medical care.
Okay, talking about drugs, a lot of drugs that we look at nowadays are mainly related to COVID-19. Now, that could have also or could also lead to ignoring drugs for other life-threatening ailments, for instance, HIV and the rest of them. How are we handling this situation?
No, there is no problem with that. The routine drugs and routine medication supply chain is going on as usual. So there has been no issue with the impact of COVID-19 on the supply chain. So we are managing that very well. The medicines for COVID-19 themselves are, well, they are generally well defined as medicines that are actually under trial because none is very specific in its own sense. But I myself have seen the supply chain, how it works, and visited the medical warehouse in Abuja not long ago. There is a good control of supply chain for medication. and also vaccines. I must mention that because that's important.
Very important.
Yes. So in fact, we commissioned some motorcycles to help to deliver vaccines to rural areas, hard to reach areas just a few weeks ago.
All right, Honorable Minister, we'll continue with this discussion. Let's go on another break. Our conversation continues in a moment. Thanks for staying with us.
If you run mad, we know waiting cause am. Every time now this phone. Have you gone to buy more units for light? Give me this phone. Ha! They don't finally get you. Enter store, you go see one pink nylon. Bring and come. If you try am.
Now that chicken where they use can look me. Now I want to. That one.
Oh! So now why you send me message when no get with this? Shate. Make yourself begin to enjoy credit and data. Berekete.
Introducing Berekete. Activate a new glow sale and get 600 Naira free credit plus 700% bonus on every recharge and up to 100% bonus on data plans. Find your first with Berekete. Glow Unlimited.
Son, being good at something requires strength. It requires putting in more. That's why the new improved Bonvita is packed with vitality and a richer, creamier taste.
She cries. She cries in anguish and in pain. She bears the scourge of her grief. She toils in vain for justice and succumbs to silence. He gloats over his malady. Like a beast, he pounces with no remorse. Her cry means nothing. Her pain feeds her shame. Like an orphan, she's left to grieve in solitude. But no more will she cry in vain. Her adversaries will henceforth bear the brunt of their cruelty. Rape is evil. Rape is a plague, a pandemic of monumental consequences. We must unite and kick it out of our society.
Connect with NTA and stand against rape and rapists. This message is brought to you by the Nigerian Television Authority, NTA.
Less than 2 weeks after resumption of flight operations at the Kano COVID-19 International Airport, Enugu, the airport is already a hub of traveling activities. Given the call for increase in the routine health services occasioned by COVID-19, airport authorities say they have put measures in place to curtail the trend. Mena Okobasi now reports.
The entrance to the ticketing and check-in lounge of the Kano COVID-19 International Airport is clearly marked 2 meters away from each, indicating where passengers stand apart to ensure social distancing. Every passenger that approaches the entrance door stops into the disinfected footmat to disinfect luggages. Temperatures are checked and hand sanitized before approaching the scanner. At the ticketing and check-in lounge, staff of the airport and passengers were seen on face masks. Also at the check-in and departure hall, sitting arrangements were done with the safety of passengers in mind. A few travelers that spoke to NTA News crew expressed satisfaction with the development and advised other intending passengers to patiently submit themselves to the rigorous but necessary safety process so as to board free from COVID-19.
It's necessary, it's required, because COVID-19 is real. It's not a fake.
Hand sanitizer is in place, and the temperature check, and the distance is also good. Yeah, I think it's very, 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 very necessary that they do that at every time.
The airport's manager, Cecilia Oguama, while commending government's efforts on the positive development at the airport, however, lamented the delay in rounding off other structural facilities, which possibly would include a testing center. She emphasized that the testing center would afford the airport authority the opportunity to check passengers' COVID-19 health status while aiming at protecting the health of others who use the airport. In Enugu, Minna Adobe Kobasi, NTA News.
The Minister of Health, Dr. Osagie Hanire, is still here with us on Weekend File. Honorable Minister, emergency services is another major area of concern. Nowadays, most ambulances are used in conveying people with COVID-19. And of course, they can be used for other patients. I don't know. How do you look at that?
Well, that's a very good question. All ambulances that have been used for conveying infected patients are routinely fumigated in such a way that the virus where present is addressed and taken care of, so they can be used for other purposes after being fumigated and aired. Well, I will use the opportunity also to say that the Federal Ministry of Health is developing a national emergency medical service and ambulance system, which will address the issues of emergency services and transportation to hospital. We are working on the concept note, going to use 5% of the Basic Healthcare Provision Fund, which is earmarked by the federal government as a seed money in order to address the issue of lack of transportation to hospital, not only for accidents but also for maternity cases and for any kind of emergency, including child emergency. And we do hope that when it's functional, it will reduce maternal mortality and infant mortality and accident-related mortality by up to 40–50%. So we're working on that, and it will have a protocol for trained manpower and also protocol for carrying patients with infectious diseases, including COVID-19, which is doing at the moment. It has worked very well in Kano, where it has been piloted, and we're going to have the launch in Abuja very soon.
Indeed, we are witnessing reduction in number of confirmed cases of COVID-19 in our country. Does that mean we have started leveling the curve in Nigeria?
No, I am not encouraging anyone to be so confident of that, because we don't want to be complacent. We don't want to rest on our oars. We do not want to say that the battle is over when it is not yet over. We have seen other countries who thought that they were already in control and are now fighting with what they call a second wave. Because apart from looking at our own country, we're looking at other countries, we are seeing what they are doing, we are seeing what mistakes they have made and how they are addressing those mistakes. In fact, there's one country now which is about to start a lockdown all over again, and that is Israel. So we are not so confident that we are so much in charge that we can say that we can now relax. We are worried about a second wave, and some countries are even thinking of a third wave already. So we need to be very vigilant. In the UK now, the cases are also increasing, and they have reduced the number of people allowed for gathering to 6 from about 30 they used to have. So they are taking more drastic measures and restricting visitors from certain countries, because they are suffering a second wave which is threatening to be as severe, if not more severe, than the first wave. So we do not want to rest on our oars. We do not want to say that we are successful yet. So we want to keep in control and remain vigilant.
But that's the mindset of many Nigerians, because schools are reopening and, of course, flights are the airports are alive once again.
Yes, that is necessary, because you have to allow the economy to reopen. You have to allow people to live their lives. To use the words of His Excellency the President, we want to preserve lives and livelihoods, and therefore transportation must reopen, the airports must reopen, and eventually schools will reopen and business will reopen. But all this reopening will come with certain risks, and we must be able to manage those risks. That is the reason why we have been emphasizing adherence and compliance with the non-pharmaceutical measures that we have been advising, particularly wearing of mask anywhere you are once you are leaving your house, and addressing also the concern about vulnerable population. There are people over 50 who are higher in the fatality rate than others. So those ones to stay home when they do not need to go out. And we also advise those who have diabetes and similar problems to stay home. So we are trying very hard to address the risks and manage the risks that go along with reopening the economy.
I think part of the problem is non-adherence on the part of many individuals, because even when you look very closely in some cars, you see people in one particular vehicle, they're not wearing masks, and you begin to wonder what is happening. Do we need to begin to reorientate Nigerians about this scourge?
We are doing that already, and I believe that the Ministry of Information is doing a very good job. They have tried. And also the National Orientation Agency, the Ministry of Health, NCDC, we are trying very hard to send out the message, and above all, the twice weekly press conferences or press releases of the PTF try to address this matter. But I think globally there's a certain amount of fatigue that is setting in, and people who are willing to say, well, let whatever happens happen. But that is not good. And if you see the fatalities rising again, and it hits someone close to you or someone you know, that's when you wake up. But that doesn't have to go that way. We want to follow the experience that we have gathered from addressing the disease so far, and make sure that we find a way to protect all our citizens from the risk involved. Schools will reopen, business will reopen, we must manage the risks. And I'm happy that traditional rulers have been supporting the initiative also.
Are there plans by your ministry and other stakeholders to monitor adherence to some of these protocols, particularly at schools where we have kids, because sometimes when you go around most schools, within the metropolis, yes, from the gate you could notice some individuals or officers trying to check temperatures and then give out hand sanitizers to kids to merely wash their hands before they get into the compound. But that's as far as it goes, Honorable Minister. Are there ways of evaluating or monitoring to ensure that these protocols are constantly adhered to?
From point of view of the Ministry of Education, they have set down protocols and guidelines for reopening schools. Physical distancing, wearing of masks. Many teachers and principals have been trained, and they have been instructed to train others and train their pupils, and to make sure that the first lesson of every day is a reminder on COVID-19. Anywhere schools have opened or reopened, there has been a spike. So we know that schools must open one day, but we have to be ready for the risks involved. So there must be a lot of communication, risk communication, and engagement of even of the students, because even as young children can understand if you give them the correct advice on COVID-19. And the same goes for other businesses. We have advised that nobody should be allowed into a supermarket or a store if they are not wearing a mask. We are asking for compulsory mask wearing, in fact, into markets. We are advocating the same for places of worship and social distancing. So all these measures must be taken to ensure that we do not suffer any repercussion from reopening the economy. From point of view of the Ministry of Health, we have given instruction to all the hospitals to start looking out for any incidents of new emergencies coming up. If more people are reporting at the emergency center, then we begin to know whether the reopening is having a negative effect or not. So we are taking the statistics, how many people are reporting now since the economy opened, and the information is being transmitted centrally to us here in Abuja through NCDC.
We'd like to thank you for coming on Weekend File tonight, Honorable Minister.
Thank you very much for having me, and I'm glad for the opportunity to address citizens.
We've been talking with the Minister of Health, Dr. Osage Ehanire, tonight on Weekend File. Time for a final break. Don't go away.
From dusk to dawn, 24 hours a day. NTA International is with you in your living room, office, everywhere and anywhere. We provide the company you desire in terms of balanced and up-to-date news, programs and the best of entertainment. Tune in to DSTV channel 251, GoTV channel 91, Freeview UK channel 264, or you can download www.visiontv.co.uk. App for iOS or Android, Intelsat 901 degree east. You can also see us on Facebook and YouTube for quality content on the go. NTA International, Africa's window to the world.
Minister of Sports says Nigeria's sports policy is aimed at improving economic empowerment of Nigerians. Gift George is our guide on sports update.
The Minister of Youth and Sports Development, Sunday Dare, says policies have been put in place to remodel the country's sporting industry from recreational to business-oriented. Speaking to newsmen in Lagos, the minister maintained that the country has to emulate other nations who have used sports to ensure economic empowerment of their populace through private sector partnership.
What I've done is to accelerate that process towards developing a business model around our sports so that this country can also try to reap from sports as business.
Nigeria Olympic Committee has joined the rest of the world to mark World Cleanup Day in Lagos. Members of the Association of National Olympic Committees of Africa, ANOCA, and a global network organizations for the promotion of clean environments in collaboration with other interest groups converged on the National Stadium Lagos to mark the day centered on promotion of a cleaner planet for humanity.
Take active part in refuse collection in one day as a way of raising awareness on the need to protect our environment.
See that we are relevant as far as the Nigerian Olympic Committee is concerned.
In football, Super Falcons captain Asisat Oshoala says gender should not be a major criteria in appointing the head coach of the senior women's national team, the Super Falcons. The 8-time African champions have been without a coach for almost a year after coach Thomas Dennerby resigned his position with a year left on his contract.
I don't think there's any problem if we have a female or a male coach. It's just a matter of bringing the best to the Super Falcons team.
In the English Premier League, there will be 4 interesting clashes in Week 2 of the 2020-21 season on Sunday. Southampton plays host to Tottenham, who are hoping to return to winning ways. Newcastle faces Brighton, Leicester City tackles Burnley, while the star match of the day sees Chelsea welcome defending champions Liverpool to Stamford Bridge. With Sports Update, Gift George, NTA News.
And that's the size of Weekend File today on the NTA. Thanks indeed for watching. My name is Kenan Ima Aborike. Do enjoy the rest of your weekend. Good night.
My brother, my sister, papa, mama, and pikin. Corona, no big pass us. We go fight time, we go win. As long as we remember to always do the right thing. Wash your hands, love each other, we go win. Oh. Corona na the virus where they worry human being. E no get Lego, but e dey waka from person to person. But we fit beat time, we fit stop time if we maintain good hygiene and practice social distancing. We go win all.
Social media is like a big notice board in the marketplace. What you put on it, everybody will see.
One major definition of integrity is that you should do the right thing even if nobody is looking at you.
At what point do we as a people stand still and say, no, we no longer want money to become that thing that determines who we choose as leaders?
We are 50% of the population, and I really feel that it would make a lot of difference, a big boost to our development if there were more women participation.
NTA, you can't beat the rich.
Do you not know that our enemies have no face? They are indigents of no state. They come from no place. And if this boat capsizes, every one of us will go under. So when the drums sound, let everybody answer. Do not say, I am the Iroko when the forest is burning. Do not say, I am the Obeche when the forest is burning. Our differences will not stop us from perishing together. So when the drums sound, let everybody answer.
You can follow us on all our social media platforms: Facebook at NTA Network News, Instagram at NTA Network, Twitter at NTA News Now, YouTube at NTA News Online. Or visit www.nta.ng. For live streaming, visit www.nta.ng/live. Now, you can stay updated on the go, be it on your TV, iPhone, laptop, or iPad, or download the NTA mobile application from your Play Store or App Store. NTA, you can't beat the rich.
In the midst of the coronavirus pandemic, information management is key.
I'm Cyril Stober.
Fatima Umar Buba.
Joseph Johnson.
Ian Ray John.
Muhammad Kudu Abubakar.
Jumbo Yusuf.
My name is Kirian Umaya.
Here in NTA, we're working very hard to make sure that everything we broadcast is accurate and up to date. Misinformation spreads very fast.
The social media has been a huge conveyor of misleading information from one individual to another, then to another set of groups. In a short while, it goes viral, and before you know it, it is all over the world.
There have been several misleading information on coronavirus COVID-19. Recently, the misconception of 5G as a cause of coronavirus is becoming widespread. Another is the belief that hot beverages and alcoholic drinks are internal cleanser for COVID-19, thereby leading to excessive consumption of these drinks.
The use of local concoctions as treatment for COVID-19 are yet to be scientifically proven. However, there has been several theories about the efficacies of these concoctions. We should stay safe and denounce all manner of fake news and misleading information on COVID-19.
For medical advice, go on the WHO website, Nigeria Center for Disease Control NCDC website, or stick with the advisories from the Presidential Task Force on COVID-19 or other authentic official sources. NTA is one of them.
This is the network service of the NTA. NTA TV College Jos, an affiliate of Ahmadu Bello University Zaria, is currently admitting students for its ordinary diploma programs in television journalism, television production, and television engineering. Interested candidates are advised to obtain relevant information concerning eligibility at our website at www.ntatvc.edu.ng or marketing department of any NTA station nationwide. For further information, contact Assistant Director, Marketing, NTA TV College Jos on 0803-314-4383 or the Academic Office of the College on 0806-980-9807. Announcer, Registrar.